Is it a relapse? Is it a pseudo relapse? What's the difference? And what can we do about it? All excellent questions and ones I will cover in today's video. Hello, my dear friends, and welcome. I'm glad you're here. A special welcome to the new people. It's nice to meet you. Multiple sclerosis relapses can be challenging for us as patients and for our doctors. Diagnosing relapses of MS in clinical practice can be difficult due to the multiple subtypes of MS, variations of symptomatology, and pseudo-relapses. Managing relapses also presents its own set of challenges. For example, evaluating if treatment is appropriate and determining which agent would be most effective for a patient if treatment is recommended. Patient education is essential for achieving optimal outcomes for patients with MS and improving patient quality of life. See, it can be hard. My hope with this video is to help with the education part, so we as people with MS can help our doctors distinguish what kind of relapse we're having. I'll also provide some tips that can help us when we're having a relapse or just maybe prevent pseudo-relapses. How's that sound? I need to start with a disclaimer though. I am not a doctor and this video is for informational purposes only. If you are having any symptoms or concerns about your MS, please consult your neurologist or MS nurse. Okay, disclaimer out of the way. Let's talk about relapse versus pseudo-relapse. Relapses and pseudo-relapses are different things, so we need to treat them differently. Relapses can be called attacks, flares, or exacerbations, but for today's video, I'm going to stick with relapse. A relapse is caused by the MS. It is typically linked with a worsening of our disease. The Multiple Sclerosis Association of America says this about relapses. They include inflammation along the nerves and myelin, new or worsening symptoms, and symptoms must be present for at least 24 to 48 hours without a fever. Some definitions state that in addition to the symptoms lasting more than 24 hours, they need to be separated by a period of time from a previous relapse by a minimum of 30 days. So, if we're having new symptoms or increased symptoms that last longer than 24 hours, we don't have a fever, and we haven't had a relapse in the past month, we're probably having a relapse, not a pseudo-relapse. And it's definitely time to consult our neurologist or MS nurse to discuss if treatment is needed. If you have any doubt at all about if your symptom may be a relapse, it's a good idea to consult your doctor. So, what is a pseudo-relapse? The word pseudo means not actually, but having the appearance of, pretended, false or spurious, sham. How rude. For those of us who've had pseudo-relapses, we can emphatically say that pseudo-relapses are not pretend or a sham. Am I right? A pseudo-relapse is something that is not caused by new damage, brought on by other influences. Urinary tract infection is the most common cause, usually subsides in 24 hours. Relapses are associated with new disease activity or worsening of our disease. Pseudo-relapses are not associated with new disease activity, but are typically associated with something else, like an infection of any kind, not just urinary tract infections. Fever, heat, stress, lack of sleep, or in some cases, cold can trigger symptoms. Most times, it's associated with our core temperature changing. It can be as little as a half a degree. Pseudo-relapses are usually symptoms that we've experienced before. For example, I get spasticity in my left leg, and it can flare when I'm overheated, overtired, or stressed. It's a symptom that I've had before, and it comes back from time to time to bother me. It can be any symptom we've had in the past, such as numbness, tingling, pins and needles, worsening of vision, worsening of balance, or bowel or bladder problems. It could be anything. Pseudo-relapses usually go away in 24 to 48 hours. A relapse doesn't typically go away that quickly, but another thing to consider is we may have an infection that we're unaware of. Sometimes they can be sneaky. If we do have an infection, it can cause our symptoms to be increased for a number of days or weeks. It's a good idea to check with our doctor so they can check for infections and then we can get treated. Before we continue, could I ask you to like this video and subscribe? It's important because it helps this channel and it will help it to reach more people through the YouTube algorithm. Thanks so much. Determining if it's a relapse or a pseudo-relapse can be challenging. Here are 3 questions you can ask yourself that can help you determine if it's a relapse or a pseudo-relapse. Number 1, is this a symptom I felt before? Number 2, did the symptom last for less than 48 hours? Number 3, are you experiencing anything that might be causing worsening symptoms, such as getting overheated, lack of sleep, infection or fever, or stress? If you answered yes to all 3 of these questions, then it's probably a pseudo-relapse. If you answered no to all 3 of these questions, then it may be a relapse. You may have a mix of answers to these questions too, so definitely reach out to your doctor and they can help you determine if it is a relapse. Let's talk about what we can do when we're having a relapse or a pseudo-relapse. If it's a pseudo-relapse, look at the potential causes and take care of those. Overheated? Look for ways to cool down, such as getting into air conditioning, sipping ice water, or using items like a neck fan, cooling towels, or a cooling vest. If it's stress-related, try relaxation techniques such as mindful breathing or meditation, and if it's chronic stress, consider speaking with a therapist. If it's lack of sleep, try to see if there are ways to improve your sleep hygiene. I've done a video on this that might be helpful, and I'll put a link above and in the description below if you would like to check it out. If the symptoms are brought on by exercise, it's okay to stop and rest, or perhaps look for a different type of exercise. I've recently found that wearing my cooling vest while exercising is a big help. If it is an infection, work with your doctor on getting it treated. And if it is an infection, it may take a bit longer for the symptoms to diminish. If we've had a fever for days and days, it may really activate our symptoms, and it may cause us to not be able to do our regular exercise routines. So it may take some time to rebuild our exercise routines. It may be on the order of weeks after the infection has been cleared up. With a relapse, work with your doctor on a treatment plan. Relapses are associated with inflammation, and oftentimes our doctors will prescribe steroids to help tamp down the inflammation and allow the healing to happen quicker. They may also prescribe other medications to help with symptoms, such as muscle relaxers or pain relievers. Can we prevent pseudo-relapses? Heck yeah, through clean living and good loving. I'm going to recommend 3 things for clean living. Eating the most nutritious foods we can find and not eating foods that may increase inflammation in the body. I eat a whole food plant-based diet. This supports our health in a number of ways, including minimizing inflammation. I will put a link above and in the description below to a video that I did on foods to avoid that may help you keep down inflammation. Next is exercising. Exercise can definitely help us to manage our symptoms and perhaps prevent pseudo-relapses because exercise can help us reduce inflammation as well. As little as 20 minutes a day can reduce inflammation. They hypothesize that exercise would improve the body's anti-inflammatory response by activating the sympathetic nervous system. Very cool. Next is sleep. When we don't get good sleep, it can lead to increased inflammation. Sleep deprivation is associated with markers of inflammation, such as increases in inflammatory molecules, including cytokines, interleukin-6, C-reactive protein, and others. 7 to 8 hours of sleep a night is highly recommended. And now on to good lovin'. Good lovin' includes self-care. We need to love ourselves enough to prioritize our own health. Some of the ways we can do this is by doing the clean living things that I just mentioned, diet, exercise, and sleep. But it also includes stress reduction, mindfulness, compassion, and kindness. My husband and I try to live using ahimsa. Ahimsa is refraining from harming any living being, including ourselves, including you. Are you actively living in a way that refrains from harming yourself? Stress is a known cause of inflammation. Large bodies of evidence indicate that stress can activate inflammatory responses in the brain as well as peripherally. Some ways we can reduce stress are to implement mindfulness and meditation, breathing exercises, and seek the help of a therapist for chronic stress. Reducing inflammation may reduce the risk of pseudo-relapses, reduce symptoms, and lead to more better days with our MS. Whether it's a relapse or a pseudo-relapse, there are things that we can do to support our bodies. To see more unhealthy lifestyle changes we can make, check out this playlist next. Until next time, be well.